Hi, Sheila Rossi here. Just wanted to educate you a little bit about Medicare. What is Medicare Part A? What is Medicare Part B? What is Medicare Supplement, Medicare Advantage, and what is Part D? Medicare is very complicated for the average person, and it's extremely overwhelming. Whether you are new to Medicare or you have had Medicare for a while, I hope this video helps. Let's start with Medicare Part A. There is no monthly premium to Medicare Part A because the tax dollars while working fund Medicare Part A. So as long as you've worked so many quarters in your life, then you are entitled to Part A at no extra cost. Medicare Part A is the hospital coverage. If you were to go and stay overnight in the hospital, there is a deductible phase that will cover 60 nights, 60 days in the hospital. So whether you're there one night or all 60 days, this deductible phase is going to cover these 60 days. Currently, it's over $1,600, but that does go up every year. Now, if you go to the hospital for one night and spend the night and come home for 60 days, your days are reset. They reset every 60 days that you are out of the hospital. So this deductible could be charged more than one time in 1 year. If you are someone who's very sickly and going in and out during that 60-day period, then Medicare will just tally up the days. After the first 60 days, it will then turn into a copay phase, currently over $400 a day, days 61 through 90, and then days 91 through 150 is currently over $800 per day copay. Under Medicare Part A is also the skilled nursing facility. Let's say that you have a knee surgery or a hip surgery. Medicare is going to cover up to 100 days of rehab for skilled nursing facility. The first 20 days is a zero copay. Days 21 through 100, there is a daily copay. Medicare Part B, as in boy, because Medicare likes to add all kinds of letters to these things. So Medicare B, as in boy, is the doctor coverage, the medical portion. The average person pays an average premium of $185 currently. Now that also goes up every year. This is a monthly premium. If you are in a higher income bracket, I would suggest going to Medicare.gov, go to the Medicare cost tab, and take a look at the gross income and see where you fall in for the premium, because it can be higher than the average. Medicare Part B has an annual deductible. Currently it's $257. Again, this goes up annually. After that deductible is reached at the doctor's office, Medicare covers 80% and they bill you for 20%. So most of the people that we sit down with, and even the average person working or retired or on a fixed income, whatever it may be, does not have that 20% just hanging around to pay doctor bills and medical expenses. So that's where we come into play, is to help compare and educate people on plans to pick up either some of those gaps or most of those gaps. Medicare Supplement is going to be one option. This is also known as a Medigap plan. These remain secondary with Medicare. There is an additional premium on top of the $185 or whatever the monthly Medicare premium is. And these plans range from $90 a month on up to $200 a month or even more, depending on age and zip code that someone lives in. These plans are going to cover 100% of the hospital after Medicare. When I'm talking about plans like this, I am referring to Plan N, Plan G, or Plan F. We really recommend Plan G, as in girl, because this plan covers 100% of the hospital, and the only out-of-pocket is that Part B deductible. Then, as long as Medicare approves as primary, the secondary will pick up 100% after that deductible. If someone picks a supplemental route, we then suggest a drug plan, Part D, because the supplement does not cover prescriptions. Depending on each person's medications and where they live is where we can suggest which companies based on each person's medications. These plans range anywhere from $20 a month on up, depending on specific medications and needs. If someone says, Sheila, I don't have an extra anything per month to pay for a supplement, and they're looking for a more affordable route with their Medicare to help fill in some of those gaps, there is Medicare Advantage. This is Part C plans. Most Medicare Advantage plans are zero monthly premium, so there's no extra cost for most plans. Now, it does depend on the area someone lives in, but typically there's no extra premium. These plans are funded by Medicare taxes. So all the taxes you pay in throughout your life fund a portion of these plans. That way, if someone does have Medicare, they can pick an Advantage plan at no premium. Now, these plans have out-of-pocket expenses much more than supplemental, but they do help fill in a huge portion of the gaps that Medicare does not cover. For example, they'll pay the larger deductibles, but they'll each have their set copays. Medicare Advantage plans are contracted through private insurance companies, and each insurance company sets the rates on the copays and how much that is, and the extra benefits that most of them do cover, such as dental, vision, hearing, over the counter. Some may cover some food benefit. Most Medicare Advantage plans include drug coverage, so you don't have to have a separate prescription plan, which is nice. So depending on each person's goals, their wants, their needs, and their budget is what route we kind of look at. But first, we really like to educate people on their choices, because truly the choice is yours. Whatever your comfort level is, whatever medications you take and doctors you see, and comfort level as well, and budget, that's kind of the route we will go, is decide, are you someone who would like a Medicare supplement plan and has the extra premiums monthly, or are you someone who would prefer an Advantage plan where you don't have to pay monthly premium? So we can kind of take a look at each person. So again, this is where we really suggest sitting down with a professional, someone who's contracted with multiple carriers, so we can kind of look at each person's wants and needs and goals. Hope that helps, and hope I didn't put you to sleep or bore you too much. Thank you.